Disease processes, whatever they are intangible things, right, that we have given names to. And what we have given names to is a complex set of physiological things that are happening.
Right.
So, you know, the joint is starting to decay.
Mm-hmm.
The joint is starting to become inflamed, right? Or my spine is, the bones in my leg are starting to demineralize and become fragile and weak. And so we call these things osteoarthritis or rheumatoid arthritis or osteoporosis. And these things are helpful to the doctor.
Sure.
To kind of help us understand the ballpark that we're in.
Right.
But really, because healing is easy, all of these illnesses fall into the subcategory of simple calcium deficiency,
Which is one of the biggest problems.
There are over 278 diseases caused by calcium deficiencies. But the tragedy of medicine in the U.S. is that your MD has no training, no clinical experience, no respect, and not even any appreciation for medical nutrition.
Right.
So they don't know that high blood pressure most often is a simple calcium and magnesium deficiency.
Wow.
And the only thing you need to support and promote the health of your blood pressure is nutrients. You don't need hydrochlorothiazide or Lasix.
You don't have a hydrochloride deficiency.
Correct. You don't have a prescription medicine deficiency. You don't have a titanium fault fake hip deficiency. Right. But you know, when all you have is a hammer, everything looks like a nail.
Sure.
And because all we have access to is MD-directed hammer and nail therapeutics, that's what we're used to. So simple calcium deficiencies are probably I see more people suffering from calcium deficiency illnesses than any other category of illness. Now again, if you have a calcium deficiency disease, do you need an expensive CT scan? Do you need an expensive ultrasound? Do you need an expensive X-ray? Do you need $300 of blood analysis, stool analysis, urinalysis? No, you don't. All that you need is the baseline, foundation, boilerplate, the medical nutrition that fills that calcium tank up. And when you get that, your joints start to recover their health. Your blood pressure starts to normalize. Your kidneys their function starts to optimize. Your chronic menstrual pain disappears. You start to sleep through the night. Why? Because your body, for the first time in your life, has all of the stuff it needs to keep itself healthy. So what do we do for calcium deficiencies? One healthy bone and joint pack per 100 pounds of body weight per month, and that is the most excellent starting point.